For the future, the development in primary immunodeficiencies, there is a big input from genetics, genomics, and all that is involved there is going to boost further what we know about primary immunodeficiency. And the first fact there is that we will be more able to provide targeted or precise medicine or precise drugs for patients, for several groups of patients. This has already been shown with some disorders like APDS, but there's many more, and there will be many more to come with all that we are learning. And by studying these pathways, we also get to learn more general ideas about these diseases or these molecules that are important for other conditions like malignancy, or like for the patients that are being treated with inhibitors of proteins that we are studying in primary immunodeficiency. I believe that we will also be able in the future to unravel malignancies more in a general way, and seeing not malignancy as we used to see infection as just a case of bad luck, but maybe also malignancy in childhood, to see it as a deficient immune system, at least try to tackle the question. I think there's a big area of research that could be digging into that topic, and that's especially why we also made it the topic of the focused meeting in Brussels in 2019. I think malignancy, especially in childhood, is going to open our eyes to what the immunity or immune system should do against tumor cells. Another big evolution that I think we are going to see is that from genomics we will be more focusing on gene therapy, gene editing, transduced cells being given back to the patients. I think there will be a tremendous evolution in the years to come, maybe in the decade to come, but we will see. It's moving very fast. I also expect that we will be able to, in a way, through registry activities, the ESIT registry is a wonderful example there. The recent output that was created on IPEX syndrome, etc., is really showing that if you put many data together, you can extract some really useful guidelines. So despite the genetics and despite this, we will still need to focus on registry and getting patient cases and patient stories together to build guidelines for the patients that we cannot treat or will not treat primarily with gene therapy and stem cell transplantation. And I also expect really a tremendous evolution. We are seeing more and more mild phenotypes of what we think would be some other condition or is just normal, and then we find a genetic cause that actually explains why some people have one severe infection in their lifetime and maybe die of it, or have one severe malignancy or one malignancy, and we can explain it. So I think our insight into immunity is also going to grow in the years to come, and maybe we will even be able to tackle common diseases and common disease manifestations rather than what was always believed to be rare. And I think that will also be a tremendous achievement of this society and of all the scientists and the physicians and the people involved.